Good evening. Uh, Welcome to the JCB Prize Literature Pass the Mic event, where by Nadia Rasheed, the Deputy Representative of United Nations Development Program in India, and myself, Anuradha Kapoor of Swayam, we will be talking about the impact of COVID-19 on women, with especially looking at domestic violence and economic insecurity. So I would like to invite Nadia to join us. Nadia, are you there? As I get, as Nadia joins in, I'd like to take this time to introduce myself. I'm Anuradha Kapoor. I'm the founder director of Swayam, which is a women's rights organization that has been working for the past 25 years on the issue of violence against women. And we provide support services to survivors of violence, as well as do preventive work around creating an environment where violence against women does not take place. Nadia, I'm waiting for you to join in. If you're there, can you please send me your link? So, okay, I think she has now sent me the link. So whilst we wait for her, I would like to introduce her. Hi, Nadia. Hello, welcome.
Hello, Manu.
So I'd like to introduce you to everybody. Nadia Rasheed is the Deputy Representative of the United Nations Development Program in India, and UNDP works on promoting inclusive growth and livelihoods and strengthening health and governance systems, as well as protecting the environment and building resilience to the crisis. So welcome, and let's have our conversation around domestic violence and economic insecurities.
Thank you very much, Anu, and it's really a pleasure to be able to join you in this discussion. So I'm going to start by asking you a few questions first, and I'd like to begin by asking you about the reports that we're all hearing. I mean, not just in India, but around the world. We're hearing in the media that reports of domestic violence and gender-based violence are increasing. Why do you think this is happening, and what trends do you see in India specifically and through your work?
Well, I think that it's true that domestic violence and violence against women has increased during the lockdown and as a result of COVID-19. If you look at the trends around the world, it's between 20 to 70% increase in domestic violence. The National Commission for Women here has actually said that it's a doubling of domestic violence cases. And an organization like ours, Swayam, which works on the ground with survivors, we have seen that, we normally have various centers through which we work, and one of our main centers gets around 22 new cases of domestic violence on an average every month. And in May and in April and in May, we got 57 on an average. That is almost 3 times the number. So definitely there has been a huge increase. And the increase, I would say, is because it's not like something new. Domestic violence has always existed. We know that more than 8,000 women are killed every year by their spouses or their in-laws. So this is something that already happens, and there are hundreds of thousands of women. In fact, 1 in 3 women across the country face domestic violence. So this is not a new thing. What has happened with COVID, because of the lockdown, the level of violence has increased tremendously. This is what we are seeing, that the intensity of violence has increased, and the brutality also has increased. We're seeing huge amounts of physical abuse, to an extent where women are having to flee their homes. And they need to get to services, and those services are not available because of the lockdown. And so there's no transport for them to, access the services. And so it is what we're seeing as a trend is not just violence in the matrimonial home, but domestic violence in the parental home. So a lot of young women we are seeing coming in, calling us up and saying how they are being abused either by their father or brothers, because again, it's so domestic violence. Sometimes people think it's more to do with marital issues, but actually it's across the board. Women are facing domestic violence in the parental home as well as in the matrimonial home. So this time around, we've seen a huge increase in young women calling us because they have been at home 24/7. And the thing is that when you're at home 24/7 with your abuser, the touch points of abuse become much higher. And there is a lot of frustration, and the frustration is easiest taken out on the women at home and the women who are dependent and the women who are unable to respond because they have nowhere else to go. So they are the easiest target, and they know that, I can take this out on this person, but she's not going to be able to respond. So this is what we are seeing as a trend.
Yeah. And Anu, I mean, these figures are always shocking, but we're in a really unprecedented situation, as you've just described, and obviously with people being more confined indoors and cut off from support systems, their vulnerability increases. So how is SWAYAM responding to the challenges that you've identified? How are you trying to address these challenges?
So, the challenges I'd really like to point out, for the fact is that after the lockdown, we weren't able to physically get out and help anybody, which is what we used to do in the past. Or women cannot come to us because they don't have any access to transport. They're not allowed out. Lockdown means you're not able to come out, right? So that ability of women to approach us and for us to be able to intervene has become very limited. And so what we did right at the start was we launched some helplines. We launched 3 helplines, which were then increased to 6 and then increased to 9 because the demand was so great. And then we publicized these helplines, so that women knew that they could get in touch with us. So that was one area, so that women knew they can get in touch. But then what was happening is that if a woman is facing domestic violence, she needs to get out of the house. Literally the next day after the lockdown, I got a call where this woman said that he's beating me up so badly. I've locked myself into a room. I've managed to do it. I need the police to get me out. So now, to get the police activated to go and take her out, that was our job. So we had to get her out of there. Now, the thing is that the police had reacted in that case. And in many of the cases that we have worked on, the police has responded, but they've also responded to a certain extent. Now, she needed to be taken out. The police takes her out. She needs a home. Where does she go? Shelter homes are now saying we're worried about taking somebody in because that person could be COVID positive. So they are reluctant to take anybody in. So this woman had a place to go to. So she was able to go to a friend's house. But other women who we had dealt with, for example, one of the women who, she was 5 months pregnant and she had a 5-year-old daughter. She was so badly abused that she had to just flee the house, and there was no transport for her to go anywhere. So she walked to her parents' home. But even her parents didn't want her there because, under lockdown, without work, she was a burden, the usual stuff that happens. So she was undergoing abuse even in her parents' house. So she walked about 15 kilometers to her sister's house and she stayed there. So, these are the issues that are coming up that, how do you deal with that? And as an organization, we really can't, support her in that way that we take, because we are not allowed out, we don't have the transport. How do we reach her to her home? So these were some of the difficulties, the challenges that we were facing. Then the courts are shut. So for example, a lot of men stopped paying maintenance to women and they're dependent on that maintenance, right? So if it was under normal circumstances, we could have gone to court to ask for that maintenance. But now the courts are shut, women can't approach. So now what is happening is women are without any money. And how are they going to feed themselves and their children? So that was another big area where, and with the lockdown, there was no work. A lot of them who are daily wage laborers or are or self-employed suddenly found they have no money. And how are they going to eat? So we had to support them through rations, providing them with food. So this was something that we as an organization have never done. So it was also for us to be able to respond to that need, and then being during this time, the stress of COVID, right? Also, and on top of that violence, mental health of women was hugely impacted. So we also have a helpline where we have mental health counselors who have been providing mental health services to women and also to their children, because the children are also impacted. So we have a mental health helpline for the women as well as for the children, and we have basically supported them through counseling, through connecting them with the police, getting the police to intervene. For example, there was another case where, again, the women, this time around, what we've seen is so many women have had to flee home. I mean, in these
Right.
2 months, we've had more cases of women having to flee home than in the entire year that we have worked in the past year. So there again, getting the police to intervene, get them to a particular place. So these are some of the challenges, and the way we have done it is to provide the support to women, but at the same time, we have run 3 campaigns. One campaign in which we have, to create awareness and also for women to know that they can approach somebody, right? So the first campaign was in collaboration with Akshara Center and David and Goliath Films, where they had done this film with Bollywood stars, actually talking about how the pandemic has increased domestic violence and women should be, you know, uh, speaking out, and people should be supporting them. We did the same thing in Bengali because we are based in Calcutta. So we did the same thing in Bengali with Bengali, the Tollywood stars. And that was a huge, sort of an awareness piece. We also did another one with Radio Mirchi because we are trying to use as many ways to get through to women, because not everybody will have access, right, to social media. So through the Radio Mirchi also we did a week-long campaign with them, and recently we've just launched one on Facebook with posters on how COVID has affected women and how men can show, who present themselves as really upright citizens, who are donating to the cause, who are absolutely physical distancing, but at home they're a different personality. So that is, through providing support services as well as through campaigning. That's how we've responded to that situation.
And it's so important to hear, all the different avenues through which you're trying to reach out to people who are in very difficult situations. Unfortunately, as we know, for many people, domestic violence it's still viewed as a private issue. And so people sometimes are reluctant to intervene, or as they see it, interfere. What do you recommend to family members, to friends, even to bystanders who may witness domestic violence or violence against women? How can they support people who are facing violence?
But I think the first thing is to stand by the woman and say that she is not wrong, that what is happening to her is wrong, and that they're there to support her. So to provide that support, to speak to her, to reach out, because most of the time women are isolated, right? And they don't want to talk about it because most people will say, what did you do? You must have done something for it to happen. So not to blame her because she's not responsible for the violence that somebody else is inflicting on her, right? So to provide that support, and then also to say that, it's perfectly all right. You need, if you need to get out of this, we're there, we'll stand by you, especially family members. Instead of saying you got to adjust, they have to say, no, this is wrong. You don't have to put up with violence, and we're there for you. I think that's really an important message, because a lot of the times women don't do anything because they feel, what will my family say? What will others say? So the family has to come out very strongly in support. And also, if you're a friend, you also say the same thing. And at the end of the day, you need to equip yourself with phone numbers, the police. You need to give her that information, connect her to a women's organization or to an organization that can provide her help. So those are some of the ways in which you can help. And as a bystander also, you create, you maybe, you're seeing something happening in front of you, you protest, you say this is wrong. And, you tell the woman, do you need help? I can help you. Or ask her, ask her if she needs the help. So it's, and as a neighbor also, ring the doorbell, or, intervene and say, this is unacceptable in our community, to give that message that we're not going to stand for this. This is, I think, a really important aspect. And yeah.
And Anu,
Thanks.
for people who may be listening to us, or who may have friends who are family members who are facing domestic violence, what can you share with us in terms of resources that could be helpful for people who'd like more information, people who'd like to ask questions, even people who'd like to know more about how to support those that they care about who may be facing domestic violence? What resources are out there? Are there helplines that you could share with us?
I think that I'd like to share three of our helplines, and these I can call them out. They are 90739 10060, 90739 170 17030, 98302 04393, and 90739 10060. And these helplines will also be put up at the end of this session on the JCB page. So I think that people can also access them if they haven't got them right. So thanks very much, Nadia, for asking me these questions. And I think we should move to you now. As I had mentioned that, the COVID-19 has affected the survivors that we work with, both, I mean, if I'm looking at food insecurity as well as losing their jobs, their employment. So we see that this is going to be a very big area for us to intervene in. So I'd like to ask you that COVID-19 has increased these social and economic burdens on women, and they've also reinforced their roles as caregivers, as we've seen that with entire families at home, they're having to engage in a lot more housework and care work. So what are these economic vulnerabilities and safety concerns that you see, and how can we increase attention to these and then provide solutions to the challenges that women and vulnerable groups are facing at the moment?
Yeah. I mean, unfortunately, as we see in many, many crises, and this one is quite a unique crisis, you really see that inequalities are amplified, the cracks in society are amplified, people who are the most marginalized become extremely vulnerable. And this, of course, very much applies to women. We see that during this time, the burdens on women have really risen. We know that women are having to take on additional caretaking roles, whether it's taking care of children or perhaps taking care of elderly parents, taking care of household chores. We've seen these burdens really increase. And of course, for families that are affected by illness, that's compounded even further in terms of the responsibilities that women have to take on. And then when we have widespread economic disruptions with many, many people losing their jobs, there's also increased pressure in many families for women to become breadwinners and to take on that role of trying to find a way to bring income into the family. And then this really does increase pressures, it increases vulnerability, along with what we've just been talking about, the increased prevalence of violence that women may be facing. Often we know that when there are families that are affected by illness, women face discrimination in a different way. It's often a heightened stigma and a heightened discrimination that women may face compared to men. And normal support networks, as we were just talking about, get disrupted in a situation where people are more isolated at home. So being able to reach out to friends and family members and so on for support becomes much more difficult. Now, of course, these kinds of social and economic challenges and these kinds of deep inequalities that exist all around the world are not so easy, as we all know, to overcome. I mean, it really takes, as we know, a very, very sustained collective effort to make progress on improving gender equality and on mitigating the social and economic vulnerabilities of women. But I think, it's important first to understand the differentiated impacts that women often face and the additional burdens that they face, and to really recognize that. Also important to ensure that they have access to information and have access to how they can access support, including psychological support, as you've also mentioned. We also need to ensure that we're really tackling myths and fears to help support women and to help ensure that they are able to reach out to services that they need and services that are available out there, whether it's services provided by government or services provided by civil society groups. So incredibly important to recognize these differences and to really support the most vulnerable women in particular to access these services.
Right. So UNDP is working very closely with entrepreneurs, different classes of women entrepreneurs and young women who are entering the workforce. So what are you hearing from them about the challenges and the vulnerabilities they're facing now with the lockdown and with, work? As we know, everybody is losing work. So how are these women who are now entering into the workforce, what are the challenges that they are facing?
Yeah. So for us, together with our partners in government and civil society and other UN agencies, we've really been working for a long time at looking at ways that we can address some of the structural issues as well as some of the social issues that hinder women's access to economic opportunities and to employment opportunities. And over the last 4 years, we've worked with the IKEA Foundation and other partners, particularly partners at state level, to expand opportunities for skilling, opportunities for jobs, opportunities for entrepreneurship for a large number of women, particularly women coming from underprivileged backgrounds. So we've reached 1 million women and young women through our programs over the last few years. And the idea has really been to look at how we can support women to gain marketable skills, how we can help them to have an introduction to the world of work. It might be through internships, it might be through apprenticeship. We've also worked on linking up female job seekers to employment opportunities and helped in doing that kind of matching. And then particularly with rural entrepreneurs and micro entrepreneurs, we've looked at how we can support women who want to embark on, growing their own business to be able to do that successfully, and particularly through models that allow them to work with a mentor or seek support from a mentor in the community to really help them walk through that journey. And a lot of the social constraints that sometimes emerge when women want to go out and work, or when they want to start a business, but they come from maybe communities that are not so open to that. So we've done a lot of work and we've seen some very, very positive results. Unfortunately, with the COVID crisis, we're hearing that the women that we've been working with have been extremely impacted. Not surprisingly, this is what's happening in many countries around the world. So we're seeing, for example, that many have lost jobs. We're also seeing for women micro entrepreneurs that they really are struggling in terms of losing access to credit, while still perhaps having to pay off debts. We're seeing that they're struggling to be able to sell their produce because markets and supply chains have been disrupted. We also see that, of course, a lot of markets are moving from physical spaces into digital spaces, which is wonderful to be able to have that opportunity for people to access markets. But for rural women, for poor women, they're often not able to benefit from these kinds of new platforms that are opening up, and from the move to less traditional ways of engaging. So this has been a very difficult period for many, many, many women, and obviously, especially for women who come from poorer communities. But at the same time, I do want to give a note of hope. We're also seeing a lot of resilience. So, for example, some of the women who we have supported to gain managerial skills have been extremely innovative in looking at new ways of alternative livelihoods to help support them and their families. They've also really taken a lead role in terms of providing relief in their communities and helping women to organize. We've seen women who have been very creative in moving their production, for example, to starting to make cloth masks and sell and obtain bulk orders to sell these. So for many women, they've tried to find new ways of getting their produce to people who need it. We've seen women who have worked with housing societies to directly supply them with basic necessities in terms of food and produce and so forth. So it's a massive impact that's being felt, particularly by women from more marginalized communities and people from more marginalized communities. But at the same time, there's a lot of innovation that's happening, and people are coming up with very creative ways to try and cope with the impact of the crisis and also mitigate the impact of the crisis on themselves, their families, and their communities.
Yeah, it is amazing how resilient communities can be. I heard about similar kinds of stories as you've been talking about of resilience. But one of the things that is true is that India has amongst the lowest female labor participation rates in the world. And now with COVID-19, how do you think it's going to impact this participation rate? Because it's bad enough as it is. And then with this, what is going to happen? And how do you think we can find a solution to this?
Yeah. So unfortunately, we have the paradox in India that the labor force participation rates for women have been declining over the last decade. I mean, they were already low, but they've actually been declining. And before the crisis, the estimate was already that only 1 in 4 women was participating in the labor force. And this is one of the lowest rates in the world. This crisis, unfortunately, is setting back many development gains. And when it comes to participation in the workforce, it will set us back even further, unfortunately. We're seeing evidence from around the world that women are losing jobs at a greater pace than men. And one study from India, for example, shows that there's a reported 40% drop in employment for women compared to a 30% drop for men. And we know that there's many reasons for this. Often women work in sectors and in job roles that are more vulnerable. They're often job roles that can't easily, for example, be done from home for people who can actually continue working from home during this time of crisis. We know that women face greater challenges with mobility and transport, and there's generally enormous vulnerability because women, on average, start from a point where they are earning less than men and they have fewer savings than men. So the impact of this crisis is going to be and is already extremely significant for women, and particularly poor and vulnerable women. And so it's extremely important that we look at ways in which women can be supported and that we can address this kind of differential impact that women face. That includes supporting women with access to social protection, but it also includes in the very important schemes that are going on to look at expanding jobs and livelihoods for everyone, that women must very much be a part of these efforts. It includes ensuring that they have access to credit. It includes ensuring that they have access to opportunities for skilling or reskilling. Particularly, the point I was making earlier that with a greater focus on digital technology and digital platforms, helping poorer women to gain capacities and really gain skills and training to be able to make use of digital platforms and digital technologies is extremely important, so that they don't fall behind further. So we really need a very strong and concentrated effort to make sure that we don't continue to see a worsening, which is, the most likely scenario in a crisis like this. So it requires a special effort to stem that decline. And this really means working together as government, the private sector, civil society, organizations like ours, UNDP, and other agencies, to see how we really support poor and vulnerable women and other poor and vulnerable communities, such as, for example, transgender communities, who are also facing huge losses, huge amounts of violence. How do we support vulnerable communities in gaining new skills and being able to cope with the impact of these crises and gaining access to jobs? And maybe one final point I'll make here is that local jobs become very important. So making sure that jobs are available where people are, because particularly for women, there are mobility issues very often. And so the closer the job is to home, the more likely and easier it is for a woman to be able to access that job and keep it.
Right. So you gave us a lot of idea about what civil society, government needs to do. But what do we as individuals do? I mean, is there anything that we can do to become part of the solution? Is there something that an individual can do?
Yes, and I think we've seen, amazing efforts from so many individuals in India who have really risen to the challenge of this unprecedented time that we're facing. I think, we need to start with raising awareness and looking at what we can do in our immediate surroundings. What can we do, firstly, in our households, with our families, with our friends, in our work environments, in our communities? How can we really advocate for people to recognize the impacts that are the adverse impacts that vulnerable women are facing, the adverse impacts that vulnerable communities are facing, so that we understand what people are going through? We need to start really by also recognizing that women are taking on enormous burdens, additional burdens in the household, and enormous additional responsibilities, which add so many levels of complexity to the vulnerabilities that they're facing. Recognizing that means that firstly, we have to look at ways of supporting them, so that women are not just taking this additional burden on their own. But at the same time, we have to work towards a more equal sharing of household responsibilities, a more equal sharing of the burdens for care. I mean, we are really in this together, whether it's men or women or individuals. We really need to look at how we recognize who amongst us are taking on additional burdens, and how can we support them to have a more fair and equitable and caring society. So I think for all of us, we have a very important role to play in tackling stigma. We know when we have a crisis like this, and particularly a disease like this, there can be a lot of fear, there can be a lot of myth, there can be a lot of stigma to people who might be affected by this. So it's absolutely critical that we each do our part in challenging stigma when we see it, in promoting correct information, and in really encouraging people to support one another, care for one another, and be compassionate, to make sure that we are able to cope as best as we can with the impacts of this crisis.
Right. It's true. I mean, I think that during this time, the individuals have really risen to the occasion in terms of support that vulnerable people have got.
Yeah.
I think it has been a lot of individuals, especially the young. I mean, I've seen that with young people as well. They've all risen to that to the occasion. So I think that society moves only if every single person in society actually contributes towards making it better. And I hope that this particular disease is going to make us look at the inequalities in a different way, because I think they've been so stark and in your face that I'm hoping that it is going to change everybody in the way they think about what a society should look like, you know, how it should be, how we can make it more equitable, so that, you know, nobody has to go through what they have been through now. The migrants that we're seeing, the kind of, you know, the food insecurity that we're seeing, you know, the kind of job losses we're seeing. So this is something that I think has made everybody, I hope, really reassess the kind of society that we want to live in and what we can do to change it. So,
yeah. And I can see from some of the comments coming up that, you know, people are raising very important points about the need for volunteerism and the need to encourage people to volunteer and make a difference in their community. I think that is absolutely critical. And we see so many volunteers who have really put themselves at the front line, sometimes face stigma themselves. Because the job that they're doing is so incredibly important in taking care of those in society who need support.
yes, and if people had not come out in that way, you know, we couldn't have. I mean, and it was also very interesting to see that people who actually made systems run, who got food to our table, you know, who made sure that our cities were clean, who made sure that we were looked after, you know, in terms of when we were in hospitals, they are the people who really we need to value a lot, you know, which is, I think, a skewed kind of a system where the value that society gives to them is so low. And it is, you know, this has proved how important it is for us to give value to all of these tasks. The people who put food, you know, out on in our local stores, who open them up for us to just get everyday food. So I think that's really important for us to take into consideration. Are there any questions? Because I can't read anything on my screen. So if you could, you know.
Sure. Can I direct a question at you? So we've
Sure.
had a question asking or stating some men are polite outside, but inside they are abusing children and their wives. What can we do about this?
Yeah, I mean, actually, this is the crux of the campaign that I was talking to you about, that we've just launched on Facebook, saying that these responsible citizens who look on the outside, they're doing everything right, but when they go back home, they are not. So we need to understand that abusers don't have a face that says they abuse. They can be perfect gentlemen outside, but they're not the same at home. So we need to recognize that. And when this happens and a woman comes out and tells you, you don't say, but he's, you know, he couldn't do it. You have to understand that he can do it. And so you have to provide the support to women or children who come out and speak and say, this is what's happening to me, because it's very hard for a child or a woman to speak out against domestic violence because of this whole stigma that is attached to it, the kind of way in which people look and behave when you're talking about this. So it, and the lack of support from family around. So I think that for people, A is to believe, B is to support, and 3 is to provide that, you know, the information and the, you know, the backing that, you know, you don't deserve this and you need to take action, and we're there standing by you. I think that's the most important message for a woman to get, that this is not her fault, and that, you know, people are going to stand by her so that she can take action. I think that's most important. And also to equip ourselves with information, like numbers of the police stations, or like, you know, knowing which organizations in your city work on these issues, passing this information to women so that they're able to call and get in, you know, get information on how they can do what they can do. So it's even that kind of awareness also needs to be there.
Absolutely, it's critically important. So I think we have time for just a couple more questions. So in case there are questions on the chat, please do post these, and Anu and I will do our best to respond to your questions.
Okay. I really can't read, but I know there's a question there.
So so the next question we have says that the world has seen a surge in domestic violence during the lockdown. How can this challenge be worked out at the system level? how can women feel more safe and feel that there is trust between the vulnerable and with government and service providers?
Well, the thing is that this is the advocacy that we're doing right now, is to make services responsive. During the lockdown period, we found services were not responsive. A lot of the support services that are normally available to women were not. For example, there were shelter homes, as I said, who were not taking in new people. Legal aid services were closed. Courts were not available to women. Um, Police were also overburdened with, relief work, law and order, COVID duties. So what we are basically saying is that the government has to treat these as essential services. These cannot
Yeah.
be treated as, something that will happen. So services to women who are facing violence of any form have to be made essential services. And the second is that they have to be made available and accessible, and women have to know that they exist. So you have to reach out to women through helplines, through making these helplines visible, and then backing up the helplines with the services. So this is I think a very important thing, because if a woman calls a line and she doesn't get a response, then she's not going to be able to get out of that situation. So it's really important for these services to be responsive to women's needs, and for women to know where to go. Because, so for example, there is no one helpline number across the country that a woman can call no matter where she is. So in some spaces there will be a particular number, in others another, and in others they don't even know whom to call. So I think these are the ways in which we need to really get. And I think that on the one hand there is the government, but the government cannot do everything. And I think a woman has a social circle around her, and it's really important for each one of us who are part of that social circle to reach out and to be there for the woman. Because, it's not going to be possible for every woman to reach out to the state. We have a responsibility as family. If my sister or my mother or my, is getting abused, I need to be there for her. And I think that is really important, that we, or my neighbor, or a friend. I think that first circle, because a woman will actually never just seek out services. She's going to seek out support from the people who she's closest to, which will be the family or the friends or neighbors. So I think we have a very important role to play, and that we should not underestimate that role, because that is the first step a woman is going to take, and that we need to be there for her.
Yeah. And Anu, we have two more questions that are coming to you. The first is how can some of the listeners who are on the session today sensitize their families to domestic violence? How can they speak to their families about this, and how can they sensitize them to domestic violence? And then a second question is, how can women in rural areas be supported, especially during the lockdown, because they have limited access to technology?
Yeah, it is a very difficult situation. Sensitizing, let me just go to that one first. I think that, this whole idea of domestic violence is a private issue. We first need to break that myth and say it isn't. It's actually a crime. If you look at the law in this country, domestic violence is a crime. So just as you will speak out against a crime if somebody robs someone, or if somebody is beating someone on the street, or if somebody is being abusive with somebody on the street, you will say this is violence and this is a crime. You will say the same thing about something that's happening at home, because just because you are a family member, it does not give you the right to abuse another family member. So I think that is what we need to be very clear about, and that's how we need to talk about the fact that this is actually a crime. And how is it acceptable for a person to treat somebody else just because they happen to be women like that? I think that's a very important way. And also, I think one of the sensitizing things is, from the very beginning, is to teach children the value of women and men, of girls and boys, to value both equally. So teaching equality right from the start, because a lot of the time what is happening in our families is that we bring our boys up in a particular way, and we bring the girls up differently. And we provide the boys all the opportunities, and the girls are the first to drop out where opportunities happen, if there is a problem in the family or even otherwise. And the goal is a girl will get married, and the goal is that the boys will, run a family. We need to shift. We need to change that. We need to say, that that women and men are equal. Once you start learning that at an early stage, and then you see that being practiced within your own home, where, as you had also mentioned, housework, care work is equally divided between men and women in the family, and the external work also can be divided between the two, and the value that you put on both is equal. Then I think that the change comes from there. So you need to sensitize at a very early age that, this is something that, because boys are not born with this understanding. They're taught that you are superior. They are taught that you have a higher value, and we need to change and make that shift. And then there are a lot of there are also a lot of boys who are treated badly because they don't conform to the image of what a man should be or a boy should be. So they also get affected negatively because of the way we're bringing kids up. So I think that is one big area. In terms of rural areas and how women can reach out, I think that, the self-help groups, and there are lots of women's groups that are working within, the rural areas. They need to be empowered. And so, for example, we are working in 2 districts, in 2 blocks in Diamond Harbour. And there we have organized women in groups, and we are empowering those groups to be able to address these issues, so that if there is a problem in their community, they are there in the community to support them. So those groups are being empowered. They're being told how to intervene. They're being, taught the laws. They're being taught how to approach the police. So that we empower a local body within the community who will then take this matter up. And then they also are people who are creating awareness within the community that this is not going to be acceptable. So the more that happens, I think, at one level, and then also that we are also asking for support services to be available at the block level, not at the district level, because it's really difficult to
as
get
close
at
as
the
possible.
block level. So that is some of the ways in which we can look at that support.
Thank you for that, Anu. I think so. This is we've come to the end of our time, and I think we wanted again just to highlight to everyone out there how they can reach out for support services, and the helpline numbers that are available for people who would like to seek support.
Right. So do you want me to repeat the helpline numbers, or I could just...
So, Anu, I think it would be great perhaps if you could repeat them again, and then thank you to the JCB Prize colleagues who will also be sharing this immediately after this live session.
Right. So the numbers are 90739 10060, 90739 17030, 98302 04393. So these are the 3 numbers that you can get at, and JCB will be putting these up after our session. And I'd really like to end by thanking the JCB Prize for Literature for providing us this platform to speak. So thank you very much. Thank you, Meghna, and thank you, Priyanjali, and thank you, JCB, for giving us this opportunity to speak about a topic, I think, topics that are really so relevant right now, and that all of us need to work together to make sure that, we end up with a better society and a safer society and a more equal society. So thank you.
Thank you so much. Thank you, Anu. It was a pleasure speaking with you, and thank you to JCB Prize.
Thank you very much, Nadia. Lovely speaking to you too. Bye-bye.
Bye-bye.